So you've said, so owners mustn't always use a physical indicator that their horse needs the dentist. What is the rule of thumb for getting your horse's teeth checked? How often should people...
Okay, let's start firstly with age groups.
Okay.
I think it's very important to look at foals, teeth, because of malocclusions, those severe parrot mouths and things that you will pick up as a foal. And I mean, they're so good now, they can really do proper orthodontics and correct that.
Okay.
Yeah, so that's important. So foal, and then I would check horses again between the age of 1 and 2, just to check.
Okay.
But your main dentistry basically starts at age 2 to 3.
Okay.
At that stage, your wolf teeth will erupt. It's your first premolar, or and I've actually got some examples of them here. They're tiny little teeth. People confuse wolf teeth sometimes with canines.
Yes.
Remember, only geldings have canines. Mares can have small little rudimentary canines. But and then your wolf teeth will actually be, this one doesn't have wolf teeth. About a third of the population will have wolf teeth, and they sit here.
And wolf teeth are the things that get a really bad rap for interfering with the bits.
Again, it depends on the position of the horse's head. Okay. And not all wolf teeth cause problem.
So you don't have to take wolf teeth out?
You don't have to. Okay. But what we do is, if you find it in a young horse, because that alveolus, the tooth socket, is not so tight, it's much easier to remove the wolf teeth in a young horse than in an older horse.
Great.
And because if you break off this little root, you can actually see it's a tiny little tooth, but it's got a very long root. And it will continue to erupt. So if you break off the root, it's going to
cause problems for a long time.
Again,
okay.
Exactly. So that's a good age to do that. And to also look at deciduous teeth. You must remember, horses have deciduous premolars. These are the
baby
premolars.
Teeth.
Baby teeth, yeah.
sorry for the vet.
Okay, the baby teeth. And these are the permanent teeth, the molars, okay. And sometimes in the young horses, you have what we call caps. They're retained premolars, the deciduous premolars.
Yes,
and they can cause problems, so we remove those.
Okay. So that would be part of your 3-year-old check on your horse?
That's your 2 to 3-year-old check. I think it's important before you want to back a horse.
Definitely, it makes total sense. To look at its mouth.
And also the other thing is, with younger horses, they have really, really sharp enamel points. They actually have ridges on their teeth.
On the caps?
On the molars.
All right.
Okay, not necessarily on the caps, on the molars. They're usually very sharp. And then the problem is, the moment you start putting tack on, and especially tight nosebands, which should be a big no-no. I see there's lots of research recently, and the FEI is also paying attention to that with tight nosebands. It's horrible. It's cruel to actually tighten a horse's mouth closed. Anyway, but that's a whole long other story. All right, so that's your 2 to 3. And then generally, horses that have normal dental occlusion, it's really only necessary to do their teeth anything between 8 months to a year. We sort of try 10 months. I have found if you leave them a year, it can sometimes just be a little bit too long. The moment you have problems where horses have had teeth removed, or you have malocclusions, which I'll explain a little bit just now, those horses are better checked every 6 months. Sometimes even shorter, but 6 months.
Sure.
You must remember, every time you rasp a horse's teeth, you actually age it. There's only
so much tooth left.
There's only this much tooth. So if you take this off, then eventually there's
nothing left.
Exactly. So I think we
actually need to be quite conservative with it.
Exactly. And I get really upset when I see horses where they've been rasped and the teeth are as smooth as this table, because also these ridges are quite important to stop horses from accumulating food in their cheeks. The moment you take this off completely, they sit with these
hamster cheeks.
Exactly.
It's really interesting
in their cheeks. Yes, and that then causes it's fermentation and can then
whole
cause
host of other
gingivitis and issues. Yeah.